And we will do a Q&A during this. As this is a meeting format, we ask that when you have a question, once we start the Q&A, if you use the raise hand feature in your reaction tab, which is, for me, it's at the bottom of my screen. It looks like a little smiley face. And if you click on that, there will be a raise hand feature. That way I can see who has questions, and you'll pop up to the top of my screen so that I can call on you to ask your question. We will also look in the chat for questions, but we ask that you please try not to use the chat for those questions so that we don't accidentally overlook them. There was some great news today. The Minneapolis City Council did unanimously pass the resolution supporting the Minnesota Health Plan and the Medicare for All Act. So yay, we're super excited about that. And my other thing that I need to say is, please make sure that you're on mute and that your video is off while we're doing the presentations. And then you are welcome to turn your video on when we're doing the chat, and then unmute only when you ask your questions after I call on you. That will just help sure that there's not a lot of background noise for other people attending this webinar meeting. Thank you very much. And with that, I'm going to hand it over to Ann Jones.
Thanks, Judy. And welcome to our Healthcare for All Minnesota and Physicians for a National Health Program monthly educational event. Judy is our Director of Operations for Healthcare for All Minnesota. Jen Crawford will be assisting with hosting and helping with questions. And she is the Executive Director for Physicians for a National Health Program Minnesota. I am Ann Jones, a retired registered nurse and Vice Chair of Healthcare for All Minnesota. We welcome you to our event this evening. If you are joining us for the first time this evening, welcome. And if you're back to learn more about how to be an advocate for our broken healthcare payment system, then welcome back. If you invited someone to join you, extra points for tonight. I think I said this event is sponsored by Healthcare for All Minnesota and Physicians for a National Health Program Minnesota Education and Outreach Committee. We are building a coalition of organizations to push for real change, including the Minnesota Nurses Association, the Physicians for a National Health Program, again, MNA and HCAM, and also a number of other organizations who are getting involved. Land Stewardship Project, Minnesota Farmers Association, Main Street Alliance, Small Business Owners, Move to Amend, trying to get money out of politics, and several other partners. These are our presenters, and then our agenda this evening will be a little bit of context from me, and then Jim Dabney will talk about effective communication with elected officials and conduct. We have some time for questions and answers. You can direct questions directly to Jim, and then Don Kilkenin will talk about our legislative priorities and kind of take us on a little tour of the Minnesota Legislature website and our organizational website as well, to show you where to find information. I will have a few announcements, and then we do have some calls to action, so you can put your citizen lobbying skills into practice right away, and then we'll do a wrap up. And with that, so if you're here because you care about fixing how we pay for healthcare, there's no sugarcoating this. Those of us who want to fix this believe that we have the economics and even public opinion on our side, but we are up against very powerful, well-financed opposition to disrupting the business model for the for-profit side of healthcare. The medical industrial complex is spending billions of dollars every year to protect the status quo. In fact, donors related to the health sector spend more than any other special interest sector in our economy to influence lawmakers and policymakers. So lobbying tends to get a bad name, and for good reason, but from its historical roots of high pressure tactics and moneyed interests attempting to influence decision makers. The name comes from influencers hanging out in the lobbies of the halls of Congress, legislatures, and offices of elected officials, sometimes with bags of money in their hands or now checks. So It's up to us, ordinary citizens, voters, patients and their families, users of this patchwork of a healthcare non-system, to use our voices and our votes to push back. So what if we use our power as citizens? How can we be better influencers for the issues we care about? And I know citizen is a noun, but what if citizening is a verb? And we're going to learn a little bit more about that tonight. This evening, we are going to hear from recently retired State Representative Jim Dabney, who was my representative for many years. Jim gave a talk to a group of us health policy advocates 3 or 4 years ago in the before time, before COVID-19. And I took notes, and I've been sharing his information ever since. He has agreed to be with us this evening to present to us and share his expertise, his experience, and his advice to help us become more successful influencers for the causes we care about. So, Jim.
And thank you for that. And
down. Okay. And
let me take a minute and see if I can share my screen as soon as I get it to cooperate.
And I have them too, Jim, if you want.
Let's try this and tell me, how does that look?
Here we go.
Are you seeing the full screen?
Mm-hmm. Yeah.
Excellent. So good evening, everyone. Ann, Judy, thank you for inviting me. It's good to be back with my friends at Healthcare for All Minnesota and Physicians for a National Health Plan, and a chance for me to reflect a little bit on my 22 years of service in the Minnesota House, ongoing advocacy on issues that I'm passionate about. So it will also be interesting, given that Ann was taking notes 4 or 5 years ago, to see how much what I say now aligns with what I said 4 or 5 years ago. We'll see, but I'm feeling pretty good about this. So let's get started on effectively engaging the policy and the political process, because the two are connected. I'm sure you've heard the African proverb, if you want to go fast, go alone. If you want to go far, go together. I was pleased to see in Judy's introduction and Ann's introduction to the meeting, the partnerships that HCAMN and PNHP have established with like-minded organizations, because really it is about together. And I'll come back to this, but in 2016, you all remember 2016, it was kind of a big political year, particularly around the first Tuesday after the first Monday in November that year. And it really, for me, galvanized my thoughts about how you make change. What's my theory of change? And it really gets down to togetherness, to solidarity, to the idea that it's we the people. So it's not about me doing something in isolation, it's about we doing things together. And that's what these organizations represent. That's what the partnerships that they're building represent. So a few things as you think about lobbying, relationships, what your role is, paperwork and tools, what's not your role, and then tools again. And I'll walk you through each of these. But it doesn't come as a surprise that, to Ann's point, the highest office in a democracy is the office of citizen. Felix Frankfurter, former legendary Supreme Court justice. The power that you have is as a constituent. If you are a constituent of someone, and we all are, your city council, your school board, your county board, your state representative, your state senator, governor, all those offices, you are a constituent, you are a voter, you are someone who matters then. And you automatically have a relationship with those elected officials. Elected officials want to be in relationship with you. That's how we get elected. And if we're not careful, that's how we get unelected too. So having that ongoing relationship between the elected and their constituents is important to them. So you have power, and the question is whether you choose to leverage that power. If you're not a constituent, you don't have the power. I'll often hear people saying, you know, I'm so mad about what's going on in Missouri, Indiana, Florida. I'm gonna call the offices of those US senators. There's actually a really good argument about don't do that, because you're interfering with the ability of those people's constituents to get through to their legislators. If you're packing up the phone line with calling, because they're not accountable to you. Amy Klobuchar and Tina Smith are the US senators who are accountable to you and are going to want that engagement. Your state legislator, your state elected officials are accountable to you. They're going to want to hear from you. So use that power, leverage that power as you advocate for the issues you care about. Got to do the homework. As Ann knows, I taught middle school for 17 years. So doing your homework is a value for me. But before you reach out, before you show up in a legislator's office, before you send them an email, do a couple of things ahead of time. Do they sit on a relevant committee? In this case, do they sit on one of the healthcare committees? You just might address them differently. You might argue a little bit differently if they do than if they don't. Have they authored any relevant legislation, either that you're looking for, that you'd be supportive of, or that you'd be opposed to? It gives you a sense of their frame of mind. It gives you a sense of who they're responding to, who they're feeling the pressure from. What is their voting record on issues of concern? Voting records are out there. You can find out how everybody votes on most everything. Check it out, know where they voted. It's a lot better of a conversation, yay or nay, if you know what you're walking into. And then have they made any public statements? Have they sent out newsletters that touch on the topic? Have they been quoted in the media? Have you seen them at public events, whether it's a town hall or a campaign rally or some other public event? Have they commented on the issues you care about? Doing this little bit of homework helps you think about how to frame your arguments to them, how to frame your advocacy. And then what role are you playing? Politics is a team sport. You got to put all the pieces together and everybody has their role. Your role as the citizen, your role as the constituent is to be the expert on your life, but really only on your life. I think sometimes people get intimidated by the idea that you've got this big, complicated piece of legislation, and the Minnesota Health Plan is a big, complicated piece of legislation, and they feel like they have to be an expert in order to say anything about it. You don't. And you don't have to be accountable for what's on, line 17 through 20 on page 47. You have to be responsible and be able to tell the story of your life. How does your story illustrate the need for the bill? How does your story connect to larger public policy goals so that this bill aligns with other policy goals? And how does it fit with partnering organizations, partnering individuals who are there in the room, whether literally when you're meeting with an elected official or metaphorically in the partnerships that you've built, the collaboration that you've built. So really what you need to do is think about, in a succinct way, what's the story you have to tell that connects you to this advocacy, that makes you passionate about this issue, and makes whatever bill you're arguing for or against so important that you chose to take time out of your busy life, come down to the legislature, go to the county board, sit down at your computer and type out an email, whatever it might be. You have to be an expert, but only on your life. That hopefully should be pretty easy. And did we? Tools. And I know Don is going to get to some of this later, so that'll be great. But having a handout, having something to leave behind, having something that talks about the more objective parts of the legislation or proposal while you tell the story is important. Gives context, gives some depth that you don't have to be the expert on, gives some contacts that the elected official can follow up with, serves as a reminder that you were there. So you want to have a handout that has been prepared by people who understand the issue, understand the proposal, can speak to that, but still is a piece of advocacy, still advocates for your position. Don may be touching on the My Bills function on the legislative page, but you can go to a spot on the House or Senate webpage, because it'll cover both, create an account, and then plug in the legislation numbers that you care about, and it will track them for you. You've got to go back in to log in again to see the updates. They don't send you emails to notify you, but it simplifies the search function. It simplifies your being able to track what happened to a bill you are concerned about. So use that, because easier is better. If there are legislators or committees that you're concerned about, everybody has newsletters. Everybody has listservs that will send out committee agendas and updates. So you can be aware of what's going on in the committee. You can be aware of what that elected official is saying, because they're going to be accountable for what they say. And you want to work on that relationship, positively or negatively. Do they announce a town hall? That's a great place to go get some face time, put a face to the name, give them the opportunity to put a face to your name, ask the questions, make the arguments in the public, where you've either organized other supportive people to be there, or you'll find other supportive people to be there. That relationship with the elected official is critical. I think of a guy, and I don't know, maybe awkward if he's on the call, but Terry lives in the neighborhood. Terry's a physical therapist. Every year on Physical Therapy Day on the Hill, Terry showed up. He talked to me about his practice. He talked to me about the legislation that was being proposed that affected physical therapy as a profession, affected the practice of it, affected patients. He became my guy on physical therapy. I don't know much about physical therapy. He does. And so he became a resource for me. The goal of your advocacy should be becoming that person on single payer for your elected officials. When they have questions about healthcare funding and billing and how we do it in this country, in this state, and how we could make it better, you want your name to be tops on their list. And you can do that by building those relationships, taking advantage of when they're out campaigning, when they're out in public events, and by making appointments with their offices. Appointments, I always recommend them. A legislator's day is busy. They're in committees, they're have meetings with constituents, they're doing caucus work, they're doing community outreach. There's events going on at the Capitol that they need to show up at and speak at, or just be seen, or just check out and see what's going on. Their day is full. If you show up without an appointment, maybe you get time and maybe you don't. Maybe they have the time available and maybe they don't. It's fair. Making an appointment, if at all possible, just assures you that they'll have the time for you. And then to come back to my real theory of change, connect with others. Individuals don't change things, it's groups who do that. And this is particularly important when I think of a lot of the folks in my neighborhood who would frequently come to me and say, Jim, you're voting the right way on the issues I care about. Now what do I do? Well, if you think back to just a couple of minutes ago, where I advised not reaching out to legislators for whom you're not a constituent, kind of left them with less to do. But really what they could do is join groups like Healthcare for All Minnesota, like PNHP, if these are the issues they're passionate about. Groups that are poised to do the advocacy, groups that can do the outreach, groups that can connect with constituents of legislators who may be amenable to persuasion. Because remember, it's that constituency thing. The secret is it's not actually that hard to influence a legislator. If I got 8 or 10 emails, letters, phone calls, whatever it might be, doesn't matter that much. It's contacts, genuine, authentic contacts from constituents on an issue that I wasn't familiar with or didn't have a strong position on. I started to pay attention. 8 or 10 will usually get an elected official's attention. So working together and doing that outreach to constituents in persuadable elected officials' districts can move them. And so that takes organization, that takes joining organizations, supporting organizations, volunteering with organizations, donating to organizations who are doing the work you care about. Folks who can get into those districts and do the organizing, do the outreach, and do the connections between constituents and their elected officials, because the grassroots work is what matters in a democracy. And Judy, I hope that was helpful. Anne, you can now tell me what I didn't say tonight from what I said 4 or 5 years ago.
Well,
we can open the floor for some questions.
do you want, I'm going to pull up my slides again, Jim, because I want you to comment on a couple of things.
All right.
So if you take your slides down, let's see, can I share
Oh, right. I need to do that.
mine?
I already took them down.
Okay, let's see if this works. Here's my notes, Jim, from 4 years ago. I thought you might want to comment on the very toward the bottom. You covered almost everything. Maybe you could comment on the bottom. We vote issues that represent the sufficient political will.
Sure. So elected officials can sometimes be criticized for doing a little bit of putting their finger in the air, but that's really what you pay them to do, is to represent their communities and to pay attention to their constituents. So they're going to want to know where their constituents are at and where they can use that position to leverage their colleagues. How can we drive this issue forward? Again, where are the partnerships? Building that political will, bringing more folks in, whether it's more folks on the grassroots level or more folks on the elected level, into the coalition is key to convincing legislators and other electeds to take the hard votes if that's what they need to do, and make those votes less hard because I know my constituents have my back. That's what political will can look like.
Thanks so much. I think we are at time for questions. So I'll take this down and let people put their screens on if you would like. And if you have a question, if you know how to use the reaction on the menu bar at the bottom, that will put your hand up and we'll see you. Judy and Jen, I'll let you take.
And we have a question from Dr. John Crossan. John?
Yeah, thank you, Jim, very much. This was really, really helpful to me. And let me give you a little background about why I'm commenting right now. I'm the chair of the PNHP Minnesota chapter. And we are working very hard with medical students and other physicians to get them to support this issue. Let me tell you a little bit of a background. I'm a pathologist, I guess a semi-retired pathologist, but I work at the university, and I know the chair of the surgical pathology department at the university, who is also the president of the Minnesota Society of Pathologists. And I have been working with him to get the Minnesota Society of Pathologists to endorse the Medicare for All, or the Minnesota Health Plan, for many years. And as you know, the Minnesota City Council just endorsed this yesterday, which is a huge, huge thing. I've been unsuccessful so far. And this individual actually supports it, and he has taken it to the board of the Minnesota Society of Pathologists. And what they tell him is that we can't get involved with this. Number one, we don't do politics. And I'd like to know what you think about that, because the Minnesota Society of Pathology says we don't do politics. And also they say, you know, we may have some members of our community who wouldn't agree with this, so we can't endorse it. So what I would like you to comment on is, how do we get organizations like this, who I think would be very powerful if we were to endorse Minnesota Health Plan, to really be convinced that this has to be done?
Well, Dr. Crossan, thank you. That's a big question. Let me just, since I apparently am a storyteller, there's a pediatrician who lives in my neighborhood. And on Pediatrics Day on the Hill, she would always come in, and we have a good relationship. I relied on her to help me when I needed pediatrician support on issues. She would also always bring in residents. She'd bring in, you know, baby doctors. I was baby doctors to learn that part of, this is my language, not hers, but part of being a professional, particularly in healthcare, is to advocate for your patients. And engaging in the public policy process is advocating for your patients. So I'm not afraid to classify this as politics, but if you find people who are, maybe framing it instead as patient advocacy in a different realm would change the way they think about it, change the frame in their minds. A traditional organizing approach would be to look at who else is on that board, who might they be responsive to? Who is in their circles? Who would they listen to? That maybe, yes, this is something that organization should support as a function of patient advocacy.
Oh, thank you very much. Actually, I had a conversation with him just today about this whole issue, and that is exactly what I told him.
Perfect.
And I'm not sure I got very far, even though he is very much in favor of this. But I just wanted to tell you that we now are working with the medical students at the University of Minnesota, and they are unbelievable. They are the ones who are really pushing for this. And we're going to continue to work with them and to get them very much involved in advocacy.
Harness that
you,
energy.
John. Thank you, John. We have a question from Linda Larson. Linda, you can go ahead and unmute yourself.
Thank you. Thank you for your presentation. I got some really good tips from you that, and I am a citizen lobbyist. I'm here tonight representing the Minnesota Farmers Union, and we advocate for people in the rural communities that are oftentimes left behind in the discussions. Healthcare is a big one for rural folks. So my question for you is, since this is both a state and a federal issue, when I go, I'm actually going to be at the state capitol next Wednesday with the Farmers Union for a lobby day. And I want to make sure I get, you know, a little bit to say about that. So I'm wondering if you would comment on, do we mention both state and federal? Do we just separate them out completely, or what are your thoughts about that?
Boy, Linda, that's a tough one, because you're absolutely right. The American healthcare system is just all intertwined and wrapped up within itself. And so the federal government plays a huge role, as you know. For my bias would be talk to an elected official about what she or he can do. And that means when you're with a state elected official, talk to them about what the state can do. If you're with the example of the Minneapolis City Council, what can they do? They can pass a resolution. They don't have to take on responsibility for things outside of their jurisdiction, but they can do what they can do within their authority. So my approach would be to focus on the state level when you're at the Capitol on Wednesday.
Thank you.
Thank you. Does anyone else have any questions? Okay,
Okay.
and you want to take over?
Okay, thank you so much, Jim. That was amazing. We so appreciate you, and thank you for all your years of service in our state legislature as well.
Thank you for that, and thank you for giving me the opportunity to be with you all tonight.
I'll
Good night.
comment I'll make one
Oh,
more comment
please.
for people who are interested in being influential. If you knock on doors for candidates, they will remember you.
Absolutely true.
And you can donate money, and that's nice, but if you get out there and put yourself in on the line to support candidates,
Well put,
especially
Ann. Good night, all.
Okay.
Thank
All right.
you.
Thanks, Jim. Let's see. I will just share our next presenter is Don Pilkinen, who is a board member, secretary treasurer of Healthcare for All Minnesota, longtime advocate for single payer financing for healthcare, and the board liaison for our legislative committee. And he's going to go over our 2023-24 legislative priorities, show us how to use the Minnesota legislature website to do what Jim suggested, figure out how to track the bills you're interested in. And then we'll pull up our HCAM website as well and show you where the information is that we keep updated on legislative priorities. We wish it were as simple as passing the Minnesota Health Plan, but it seems that there are probably steps along the way. So we want you to be informed and up to date on those. Let's see. I think I will. Don, do you want to go ahead and talk through the narrative that you have provided, and then I will pull up the document that you sent me.
Yeah, I'm unmuted. So first of all, well, thanks, Ann, and I really want to thank Representative Jim Dabney, retired, and he probably enjoys that title as well after the great public service that he's done for so many people, so many Minnesotans. And as a citizen lobbyist, I thank him for the information and insights that he's availed to us tonight, and that he did at the quarterly meeting some time ago. It shows how to be effective in communicating and building relations with legislators. In other words, as he said, how to be an effective constituent, which you earlier noted, Ann, is according to Brandeis, is really the highest office. And so we should hold that office high and use it. And so again, thanks, Jim, for showing us how, again, to use what we need to do what we have to do effectively. Because legislators need to see local support for the Minnesota Health Plan, HCAM advocates have been already busy building this support by getting 7 city council endorsements for it so far, with the 7th being the Minneapolis City Council's unanimous endorsement this morning. So, Jim, we've been building that political will that you mentioned earlier. Meanwhile, we've been in touch with the Minnesota Health Plan Legislative Caucus on our legislative priorities, beginning with the Minnesota Health Plan, along with the related, what we call building block bills. because they build support for the Minnesota Health Plan with the single payer principles. So now that the legislature is in session, these building block bills increase the opportunity for us citizen lobbyists to meet with and move more legislators towards the Minnesota Health Plan, for which Jim's information, as I said earlier, will come in very useful. Here are the bills with their principles to contain costs and direct our precious healthcare dollars to the real caregivers, the doctors, nurses, hospitals, and not to for-profit insurance middlemen. Removing profit from healthcare delivery saves money to make quality medical care with provider's choice affordable for all Minnesotans, which is our goal. The bill's numbers will be added when they're introduced, and you can see on the screen that there's no numbers yet for the Minnesota Health Plan, the primary care case management bill, and the cost study. But then you see a number for the Freedom to Choose bill, which of course has been introduced. So as we go down the list of bills, beginning with the Minnesota Health Plan, we see the cost-containing principles, again, cost-containing, being administrative efficiency and elimination of the costly insurance bureaucracy. We hear so much about government bureaucracy, but I think that the corporate bureaucracy running healthcare is a lot more less helpful to the quality of our lives. And that bureaucracy contains underwriting, costly underwriting, marketing, CEO salaries, and stock options. And that's probably why these HMOs, which are supposed to be nonprofit, why they're so valued on Wall Street. Annual global budgets for individual hospitals to replace the costly tasks of itemizing supplies and services, all the patchwork billing that's going on, and they're collecting individual expenses. Bulk purchasing of drugs and medical supplies to lower costs through that volume purchasing, and fairly negotiated provider fees. Furthermore, provider choice will be allowed by the removal of the health insurance networks. The primary care case management and direct contracting, PCCM bill, although it's meant for the smaller population of medical assistants and MinCare enrollees, it contains costs by directly paying healthcare providers, nurses, social workers, counselors, again, not the insurance companies, for coordinating care to medical assistants and MinCare enrollees. Not renewing contracts with the for-profit managed care plans. Again, not removing their contracts for administering these programs. And Connecticut, some years ago, has terminated the HMOs from its public health programs. Furthermore, enrollees will have choice of providers because they wouldn't be confined in HMO networks, and coordination and quality care will improve for enrollees along with saving taxpayer dollars. The Freedom to Choose bill, and I love that title, Senate File 404, House File H16, is another bill we support because it allows medical assistants enrollees to opt out of HMOs, which in turn allows the enrollees the freedom to choose appropriate healthcare providers and provides payment transparency and accountability of tax funds for medical care of the majority of enrollees who will no longer receive care through the HMOs. It'll be done in another way, more cost efficiently. An analysis of cost savings is provided for in the cost study bill designed to compare the cost of the Minnesota Health Plan to the current for-profit health insurance market by reduced insurance, billing, marketing, and underwriting costs, reduced prices on drugs and medical services, and reduced administrative costs to businesses and government. We're expecting the bill to be introduced later this session, and we're confident it will show large savings, just as many prior studies of single payer in the US have demonstrated, such as that of the Congressional Budget Office. We're also looking at legislation that creates a Prescription Drug Affordability Board, Senate File 168, House File 17, because it follows the #1 recommendation made by the Attorney General's Task Force on lowering drug prices. That came about, I think, a couple of years ago, and Rose Roach was on that committee. However, there are provisions in the bill that we're checking out, including the range of drugs covered. So far, it appears that it's fairly limited, and so we prefer to see a wide range of drugs covered that would be made more affordable through this legislation. And the extent of price increases that would be allowed by the board. And that, again, may be somewhat limited. Another bill, the MinCare Expansion Public Option Bill, Senate File 49 and House File 96, is getting attention, deservedly, because it extends coverage to more family farmers, small business owners, and others who depend on individual insurance. It may be well-intended, but in our point of view, it lacks the single-payer principles to efficiently direct our precious healthcare dollars to the real caregivers and away from for-profit HMOs. And enrollees won't have provider choice by still being confined in the HMO networks. Although SF 49, HF 96 has elements we support, like covering the undocumented and striving to provide a more affordable health plan option for small businesses and farms, HCAM recommends the authors of this bill, or the House and Senate bills, that they amend the bill to make it clear that the MinCare public option is indeed a fully public plan without HMOs imposed on it, which currently is not the case. So now we come down to what you folks are here for tonight, because there are bills that may need watching. We need citizen lobbyists in the legislative process to watch for the introduction of these bills and to track them through the legislative committees to which they are referred. In other words, we need all eyes on deck, to play on that old sailor metaphor. And we'll now review the Minnesota Legislature homepage and then scroll down to the My Bills tracking button to click on to show how easily we can become bill trackers. So Ann, do you want to scroll down down in that middle column?
Sure. I'll point out a couple things before we do it. This is a busy website and there's a lot going on, and you can get a lot of information by moving around a little bit. I want to just say that if you are looking for your member of the House of Representatives or the State Senate, you can look under the House and the Senate. And then you can, as Don said, if you want to become, you can look up a particular bill by just putting in a bill number if you happen to know it. And then, or you can use this My Bills function, which lets you go to a screen called My Bills. And as Jim mentioned, you will have to create an account, but it's pretty easy. It happens immediately. This is Don's account. So let's see if this works. We'll go ahead. Oh no, failed.
Maybe I can use it because it
I
had,
here, sorry. I forgot to tell it that I was not a robot.
okay.
That you are not a robot. There we go. Okay, go ahead, Don. She says it.
Okay, so first of all, of course, the reason we become bill trackers and to go to this page is we want to be able to track the bills that have been introduced. And again, the Minnesota Health Plan, the PCCM bill, the cost study bill, you won't see here now because they have yet to be introduced. But we expect them to be introduced in not too long a time. So when they're introduced, those bill numbers, which we don't know, they change every session after, especially with the Minnesota Health Plan that's been reintroduced over the years. Every time a bill gets introduced, it gets a different number. So again, we're waiting for those unintroduced bills to be introduced to get the bill numbers that we can put in here to add on to the bills that are already on this page because I put in the numbers earlier. So, and we have the drug price reduction bill. It's not titled that way. That's HF 17 and then SF 49. But then go down to scroll down to the Medicaid opt-out bill, Senate File 404. And there you can just scroll down to the I don't think well, it is introduced in the House. It's HF 816, but I didn't put that in. But we do have the Senate file number, so that means to learn more about the bill, go down to that second row and click on View Status of Bill in the Senate, and yeah, that one. And so you see, and I like this one because it has a description that some it relates more to the bill than some other descriptions, which kind of wander off, in my opinion. But this one is medical assistance enrollees permission, gives permission to opt out of managed care. In other words, HMO enrollment, which we covered earlier. And you can see so far that there's 5 authors, Senators Mon, Abler, which makes it bipartisan, Marty, Klein, and Bolden. And then you scroll down a little bit further and you can see the action that has been taken on the bill. It was introduced on the 19th of January, and then it was referred to the Health and Human Services Committee, and another author, the 5th one, Liz Bolden, was added. So that's where it's at now. And can you Ann, can you go to the next page? I think there's, can you scroll up?
Sure. I'll just comment that anything that that highlights when you point to it, you can actually read a bill where it says bill text
Right.
as introduced. That will bring it up. And did you, let's see, I probably have to go back because I'm in the bill. Okay,
Okay, there's another, when I was, yeah, just go to the, yeah, go to that previous page.
I'm on your bill tracker page. I might say that even if you have it put in as a Senate bill, it will also say status on the other side, the other chamber, the
Yeah,
House. And then you already looked at the committees that has been through. Okay. And then what else did you want me to show, Don?
yeah. Can you go to the next, the previous page?
The previous page would be the website.
Oh, yeah, you're right. Yeah,
Um,
okay, so, yeah, go to the top again.
Okay,
And I just been playing around with this myself, so those of you who want to be bill trackers, you can play around with this as well. So at the top, you see under my name, the main page, and then edit bills. And I was kind of playing around earlier with that. So can you click that on? I want to take a look at that.
well, I was just gonna say, if you wanna add a bill, you go over to the right, and
Right.
then you can add a bill number. You can find the numbers of the bills that we're watching on our Healthcare for All Minnesota legislative website. And then, so Don, did you want me to leave the bill tracker page?
No, just go down to beneath my name. You see that row?
Uh-huh,
And click on edit bills.
okay.
And so there's more information, excuse me. I shouldn't be talking while eating a cough drop. I apologize. And so there's maybe some of the information in a different arrangement. You can see the bills in the left column, HF 17, SF 49, SF 404. And then you can kind of edit this page as bills are added. And so I think that's pretty much all that I wanted to point out to you.
I think we were gonna let people know that there's one more fun feature you might be interested in. If you actually get so carried away that you're like some of us who wanna watch hearings and you can't personally go down to the Capitol, which by the way, when our really, really, really important bills start getting hearings, we will send out alerts and ask people to perhaps attend hearings in person, because that makes quite a statement, people who are interested attending hearings. But there is a function down at the bottom where it says get connected, and you can sign up for notifications of committee hearings and which ones are on video. And you can watch floor sessions, which can be kind of interesting sometimes. All right, I think that's the only other thing I wanted to say.
Okay.
Is that it, Don, for that?
Yeah, if you show the bottom of the page, I think it shows where you can get connected.
Mm-hmm.
And I think Jim mentioned earlier the House News and the Senate News, and that's at the bottom right.
Mm-hmm. If you want your inbox cluttered with a lot of legislative stuff like mine is, you can get the session daily, and then you can get the Capitol Week in Review. Yeah.
But if you want to
Right
be in
there.
the know, this is the place to go.
There to go. Yep. Yep. And I'll take that down and I'll show you, let's see, our Healthcare for All Minnesota legislative page. Let me see again, share screen. We are trying to, let's see. We're trying to keep this up to date. Oops, not that one. That's meeting minutes. Share screen. Share screen. My apologies. I think this is it. that's our, did I get that right? Can you see, Healthcare for All Minnesota, take action? Can you all see that?
Yes, Ann, it's up.
Okay, thank you. So we're trying to keep this up to date. There's a lot of information on here, a lot of stuff that Don went through today, but we're trying to give rationale for some of the bills that that we care about, so that if you do choose to contact your representative, state representative, or senator, you've got some talking points right here in front of you. You don't have to come up with those yourself. Okay. All right. And then I think that's it for Don. Anything else before we go on to
That's all I can think of right
some
now,
announcements?
but,
Okay,
and when I'm asked, whenever I'm asked, is there anything more? I come up with that, knowing that there's always something more. So, but anyway, that's all I can think of right now.
all
Thanks.
right. Thanks so much. This represents a lot of work on the part of our legislative committee. I just want you all to know. Some current slides. Okay, this is just, you'll get these slides, everybody who registered for this event this evening, just describing the dual track that we've referenced on our way toward a single payer healthcare financing, both the state-based bill track and the federal track, Medicare for All. And as one of our most important presidents said over 150 years ago, public sentiment is everything. So even though we get a little intimidated by the amount of money that goes into, you know, trying to influence lawmakers and policymakers, public sentiment can make a difference. And without it, nothing succeeds. So that's our pitch for becoming an activist, and helping us provide the grassroots support for making this important change. So if you are not yet on our mailing list, please go to hca-mn.org and give us your contact information so we can stay in touch with you. We send out monthly newsletters and occasional calls to action, as well as opportunities to volunteer to help us move this issue forward. So ordinary people can turn public opinion into political will. We just have to use our voices and our votes. I also believe that leaders, you know, candidates and office holders who champion this and run on change will make a difference as well. This is a sneak peek of our educational event coming up in April. And we're going to talk about bringing more people to the fight and creating more activists, more people like us, because it's going to take an army of influencers to make a change that is this significant. So, and then eventually, you know, even though we have a legislature that is more friendly to health and human services, which we have been working toward for some time, we're going to have to fill the seats in these hearing rooms. We're going to have to fill up their inboxes and fill that rotunda to make sure that they understand, you know, that we want change. So a couple other things to do to help us take some action on this. These are some things that people can do as individuals and or in talking to friends, families, coworkers, and getting together in groups to take action. I've got some announcements. We'd really like some interaction with our social media sites, and we've got the addresses up here on the slide. Continue to call and write in response to action alerts. Please see the calendar for other meetings and events. Thursday, February 23rd, Senator Marty is going to be talking at an event sponsored by the St. Croix Valley Indivisible. So that event will show up on our Healthcare for All Minnesota calendar. You can always go, you should be able to go to our website, look at the calendar, and sign up for events that are on that calendar. Our next quarterly general member meeting is going to be Thursday, March 4th. And then again, our next educational event will be April 13th on building our base of support and bringing more people to the fight. And I also look for events designed to bring younger people into this movement. A few just resources for you and useful websites. And again, how to interact with our social media sites. And really, in the end, it's about social justice. So in recognition of Black History Month, we'd like to remind ourselves that healthcare is a justice issue that crosses racial, social, economic, gender, and political lines. And as Martin Luther King said in his letter from Birmingham jail in 1963, injustice anywhere is a threat to justice everywhere. We are all in this together. Here's kind of a look at some of the actions you can take to put your citizen lobbying skills to work right away. One is the one we've shown in the past, which is all about trying to push back against privatizing and monetizing Medicare. Another one is about the proposed merger between Fairview and Sanford health systems that we think is really a dangerous anti-trust, monopolistic, market-based approach to healthcare that will not save money, and we will not serve the public well. And we are especially concerned about our academic medical center here in Minnesota that could get caught up in this proposed merger. So we've got some hints for how to take some action on that. And the third one, which is new, may be new to you and is something that we've become tuned into over the last couple of years, is that every year, or every couple of years, I should say, the commercial health insurance industry lobbies members of Congress to sign a letter addressed to the administrator of Medicare and Medicaid, CMS, Centers for Medicaid and Medicare and Medicaid Services, praising the benefits of Medicare Advantage and asking for those benefits to be preserved and expanded. We know that Medicare Advantage plans often delay or deny outright coverage for healthcare and are systematically draining our Medicare trust fund by upcoding and overcharging Medicare to the tune of billions of dollars a year for healthcare and prescription drugs. So we put the number for your U.S. senators and your member of Congress on the screen, on the slide, and on the screen. You can take a screenshot of this one if you want and take action immediately. But that's the Capitol switchboard. They can connect you to Senator Tina Smith, Senator Amy Klobuchar, and your legislator, your member of Congress, I should say, not legislator. So mine is Ilhan Omar, and she's CD5. St. Paul is Representative Betty McCollum. We've got Dean Phillips over in CD3, Tom Emmer up north of us, Angie Craig to the south of us. So hopefully you'll be familiar with who your congressional district is and who your representative is. So that's something you can do right away. And then as a wrap up, I want to just say thank you so much for attending this evening. I hope that you've learned something and found this to be valuable in helping you become an influencer and a citizen lobbyist.
Thanks, Anne. We're ending this meeting a little bit early tonight, and we are doing that on purpose because we're encouraging you all to go in right now and sign up for your My Bill your My Bill account so that you can go do that right now. We're giving you the time to do it right now. If you guys have any questions, you can always contact Healthcare for All Minnesota at info@hca-mn.org or PNHP Minnesota at Jen. Your email address is pnhpminnesota@gmail, correct?
That's correct.
Okay. Or PNHP Minnesota, all spelled out, at gmail.com. We will be sending out within the next week all of the documents from tonight, all the PowerPoints, Dawn's document with all of the bill numbers on it. That will also be posted on our website. So please know that that is coming to you along with the recording of this video. So look for that in your inbox. And with that, I'm going to say good night.
I wanted to answer a couple of questions.
Oh, okay.
Somebody put a website, yes, mhpcaucus.org lists the members of the Minnesota Health Plan Legislative Caucus, I think. Is that right, you guys?
Yeah, I put all of that in the chat.
Okay.
I was answering questions.
And then we've got hca-mn.org, and then mnhealthplan.org is the website for the Minnesota Health Plan itself, just loaded with information. Somebody asked about the drug pricing affordability bill. I do not believe that include, I don't know about medical devices. We'd have to read the bill.
We're in the process. There's a
Of
lot of
studying
bills
that
right
one,
now, and we're
yeah.
in the process of reading them all.
Mhm.
I will point out Dave Garibaldi, one of our board members who works with Don Pilkinen on the resolutions committee, which is a subcommittee here within Healthcare for All Minnesota. They're looking for help in getting resolutions passed in other cities. So again, Minneapolis passed it unanimously this morning. St. Paul has passed it. Brooklyn Park and Brooklyn Center, correct? Duluth, Osseo, and St. Louis Park. So we need some more cities. So if you would like to be a resolution advocate in your city or county, some of the areas may be a county as opposed to a city, and that's fine. But if you want to be it, we need you. We need you to contact us. You can email me at info@hca-mn.org, and I will put you in contact with Dawn or Dave, so that you can get the support you need to get that started. Or if there's people already in your area, put you in contact with those individuals.
We've got some activists in Mankato working on city council in Mankato, and we'd love to have a push in the St. Cloud area, just for ideas out there for cities that we think would be, I mean, with Duluth, Minneapolis, St. Paul, Mankato, those are pretty big cities. That's quite a lot of population in Minnesota covered with the resolution. So anyway, any other questions from anybody? Or comments? And otherwise, we will allow you, let you enjoy the rest of your evening.
Thank you, Ann.
Yeah.
Yeah. Thanks, Ann.
Thank you, Don.
Thanks, John.